Hi, Dr. Pelto here. I had a question from a patient. This was another patient that I saw in the office this last week. Her question was, what can I do for a rash in the back of my heel? This patient had seen numerous podiatrists, dermatologists, and she had this big rash on the back of the heel. You can see the dry skin. That's a little bit easier to deal with, but the skin has actually started to elevate. It's become red. It's very irritated. And this patient had been treated previously with an antifungal medication, a cream, which is pretty common. It's an easy way to start with Lotrimin cream or something similar, but that really didn't, it made it a little bit better, but then it got worse. Now, the backstory with this patient is she does not have a history of any psoriasis. That's something that can look very similar to this. And she had tried an antifungal, and also she's tried a little bit of a steroid, but nothing got better. When she came into the office, I don't like to just try more creams. I like to figure out what's going on. And the way I do that is I do two little biopsies. If you can see this little round circle, I would take a little piece of skin right there and maybe a little piece of skin right there. I numb it up with some lidocaine with epinephrine that just makes it stop bleeding. And I take two little pieces of skin and I send those out to a dermatopathologist. And when I send that out, I just put a little gauze and Band-Aid on there. And that's the best way to get a definitive answer of what's going on. Many times we think we know what's going on, but there are a lot of different skin conditions that can look very similar. But just kind of looking at this, what I would tend to start out for treatment is a very strong steroid. Now they call it an ultra potent steroid for a period of time. And that could be betamethasone or something similar to that. Another thing that I like to use is something called a vitamin D kind of analog. The specific one I like is calcipotriene, CALCIPOTRIENE. It's a vitamin D analog, and what it does is it helps to turn over the skin faster and helps it to kind of get rid of that elevation and thickness that there is in the skin. Once again, I am not a dermatologist, but for some reason, as a podiatrist, we see a good amount of dermatology. And I've had some patients with these skin issues, they get better with a combination. One thing to remember, if you're being treated, everything takes much longer than you think. Much longer than you think. I know when you look at the medications, they say you should only put it on for 2 weeks. I find it might be 4 weeks, it might be 6 weeks, it might be 8 weeks. And a combination of both of these creams works very well. These aren't something that you can get over the counter. You can't just go to Amazon and buy them. You would need to be seen by a podiatrist or a dermatologist. They would tend to do a biopsy, and then you can figure out what's going on. There are many different foot types of dermatological things. I'm going to put here a video of another video that I did on skin conditions of the foot and ankle. If you want to look at some of the other common skin conditions and some of the treatments for them, also I'll put another video. And I would like to ask you, if you found this beneficial, please subscribe to this YouTube channel, and also put a comment underneath it. Tell me kind of what you think, what other questions you have, and I'll try to do a video on some of your other questions that you have. Once again, I hope you guys found this beneficial.